Well, welcome back to the Medical Minute. And now we're going to go to the long slides of creatinine and really get into the clinical manifestations. We'll review the normals again. So normal is zero point 0.6 to 1.2 and optimal is zero point 0.8 to 1.1. So what does this mean? Well, what it means is this is looking at the kidneys and muscle. And so, clinical manifestations of problems with creatinine and thereby also the kidneys is a loss of muscle mass and endurance. If you're injury prone, you keep getting injured, you keep pulling that muscle. Well, you really need to look at creatinine and you need to look at kidney function and liver function, issues with cognition and brain health. So, if your detox system and your ability to excrete things, think of the kidneys and liver, if those things are impaired, then also cognition and brain health will be impaired because the blood isn't getting cleaned. Things that will slow cognition are allowed to recirculate, and that's just not good. Sarcopenia. This is a very interesting one to me because we see this actually quite a bit. And we do BIAs and we're starting to do more DEXA scans because we found a DEXA scanner near us. But this allows us to look at body composition. And so we know at certain ages what your body mass or composition should be. And now we can start to see visceral fat. We can also start to see muscle. So when we're looking at things like this, the thing that we figure out is lo and behold, there are some people who can look okay, but their muscle mass isn't what it should be. And since it isn't, they are prone to getting sick and they are prone to problems. And so sarcopenia is not having enough muscle mass, but you have more fat. So then the person can actually look phenotypically or their body can look okay, but the problem is they don't have enough muscle mass. Next is heart failure and skin aging, problems with the body's ability to utilize collagen. When we look at decreased creatinine, and what does it mean? Well, if you're not producing enough creatinine, then you will start to lose muscle mass. You can't maintain this. And so you need to look at muscle mass, you need to look at testosterone, you need to look at other hormones as well. Low creatinine can be indicative of a sedentary lifestyle. So, once again, lifestyle plays a huge part of what our health is. Are those five foundational pillars in place? Is sleep good? Is movement good? Is nutrition good? Is the stress good? And is the community good? And then, last but not least, if we see chronically low creatinine, you can start to look at degenerative diseases of the muscles and think of ALS or MS. What does high creatinine indicate? Well, it can be high because you're dehydrated. So if you're not getting enough water in, then you don't have enough fluid in the blood to keep things moving through. And so it becomes more concentrated. The other thing is urinary tract congestion. We are dealing with the kidneys. So if there are problems in the urinary tract that cause you to not allow things to move out, then there's a problem. And that kind of goes down to that BPH, which, if you don't know what that is, that's benign prostatic hypertrophy. So those two kind of go hand in hand, as well as the renal insufficiency or diseases. It can also indicate anterior pituitary dysfunction. If you're a heavy duty exerciser, then creatinine levels can be high because not only are you stimulating muscle growth, but you're probably also supplementing with creatinine. So you've got to ask those questions. Cardiovascular disease and uterine hypertrophy and inflammation. So if you're having problems with your blood work being off, that's where a functional medicine provider like myself comes into play because we're here to help you put things in place so that your health is optimal and you get to live and do what you want to do. That's kind of our hope for everybody, that we can help them get this foundational health established. And then we can start to work on and reverse chronic diseases. And this is why we're trying to teach you about your blood so you can take control of your health. Have a great day.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.